My name is Dr. Stephen Davis. I own Green Hills Plastic Surgery, and I'm a board-certified plastic surgeon and have been board-certified for over 30 years. I'm a member of the Plastic Surgery Society, and I'm a member of the Aesthetic Society, and board-certified through the American Board of Medical Subspecialists, Plastic Surgery. Today I'd like to talk about facial rejuvenation and revolumizing the face. Unfortunately, as we age, we lose volume in our face. And the second unfortunate part is that gravity works. So in reality, what's happening is our face is decompressing and our face is falling. So how can you approach improving this in a non-aggressive surgical manner? Based on the quality of the skin, based on the tissues of concern, lipofilling with fat grafting works very nicely, and another option is using fillers. Fillers are a gelatinous material that over time will be reabsorbed. It is the exact material that's in your joints and in your eyeball, and the body tolerates it very nicely. Part of filling and revolumizing and youthifying the face is where and how you place the material. I believe that the three-dimensional look, understanding the anatomy, is a huge component of this. One of the things that we see often in the office is patients have gone to other locations or spas where they have the injection specialist who has taken a weekend course and has learned the only way to improve the fold from the corner of the nose to the corner of the mouth is by filling that fold. And in my view, I see that as not being correct. The issue is that the cheek has lost volume, and so as a result, the cheek has fallen, the lip is stable, and now the cheek is rolling over the lip, forcing that crease. So in my mind, the issue is start at the cheek, revolumize the cheek, fill that. You're going to get lifting, you're going to get shape, you're going to get form, and then move down to the nasolabial fold or to the corner of the nose or to the corner of the mouth. It's all about shape, it's all about positioning it correctly, it's all about what layers you place this in. These materials work very nicely, they're tolerated very, very well. I like to use a blunt cannula. I think that's important. The cannulas we use are rounded at the tip so they do not cut their way through the tissues. They simply push their way softly through the tissues. The gel comes out of the side of the cannula, not the tip of the cannula. So we create a tunnel and we leave a thin, fine line of filler. We do that in multiple planes. So if you can envision your mind taking a simple kitchen sponge, placing a needle in it, and as you pull the needle out, you fill that tunnel that you've created with gel, and then do that multiple times. Now what you've done through careful direct placement is you've allowed that sponge to expand, and therefore you're adding volume and fill. The cannulas work very nicely. The ones we use are flexible, they're soft, they're blunt tipped, they're side ported, and as a result, the benefit is excellent. The other thing that I like to do is I will inject and then hand the patient the mirror. Let the patient, both male and female, see the changes we've made, and you help us make the decision as to how much you want, where you see an issue that we may not see. And between the two of us, during these injection periods, we'll offer the best changes and the best placement so that the results are nice, clean, soft, and youthifying. The other option that's available is utilizing fat. We do a lot of fat grafting. The benefit to fat grafting is that you get a limited liposuction at the same time. We take that fat, we clean it, we prepare it, We then re-inject it into the face using a similar style cannula. The tip is blunt, it's not sharp, so it softly pushes its way into the tissues. It does not cut its way into the tissues. And then, just as I was talking about a minute ago with fillers, we leave fine lines and fine thin strands of fat, which will allow the tissues to expand and revolumize the face. Fullness is youth. Not necessarily the fact that lines are present, but it's volume. If I look at my kids, you'll see my children have nasolabial folds. They have lines on their face. What they have that I don't have is they have volume in their face, and volume positioned in the right places, therefore giving them a youthful look. We try and replicate that with fat. We try and replicate that with fillers. I hope that gives you a better idea and understanding of revolumizing and youthifying the face. If I can be of any benefit to you, or if you'd like further discussion, please feel free to contact us at any time. We'll be happy to discuss this with you at Green Hills Plastic Surgery.